Women vaccinated against COVID-19 transferred SARS-CoV-2 antibodies to their breastfed infants, potentially giving their babies passive immunity against the coronavirus, according to University of Massachusetts Amherst research. The study, published in the Journal Obstetrics and Gynecology, measured the immune response to the COVID-19 mRNA vaccine in both breast milk and the stools of breastfed infants. According to the researcher, this research is the first to detect SARS-CoV-2 antibodies in stool samples from infants of vaccinated mothers. This is really important because women want to know whether their babies have these antibodies, and this study shows that antibodies are being transferred via breast milk. Providing this compelling evidence is motivation for women to continue breastfeeding after they receive the vaccine. The antibodies were detected in infants regardless of age, from 1.5 months old to 23 months old. 30 lactating women from across the US, most of them healthcare workers, were enrolled in the study. They received the COVID-19 mRNA vaccine between January and April 2021. The women provided breast milk samples before they were vaccinated, across 2 to 3 weeks after their first vaccine dose and across 3 weeks after the second dose. They also gave samples of their blood spotted on cards 19 days after the first dose and 21 days after the second dose. Infant stool samples were collected 21 days after the mother's second vaccination. Pre-pandemic samples of breast milk, dried blood spots, and infant stools were used as controls for the study. The samples were tested for receptor binding domain (RBD) specific immunoglobulin IgA and IgG antibodies. In the breast milk samples, anti-RBD IgG antibodies were found to neutralize the protein spike of SARS-CoV-2, as well as 4 variants. A significant increase in cytokine levels also revealed the immune response in breast milk samples. Anti-RBD IgG and anti-RBD IgA antibodies were detected in 33% and 30% of infant stool samples, respectively. The levels of antibodies correlated with the vaccine side effects the mother experienced. Women who did feel sick from the vaccine was associated with greater antibodies in the infant stool. While lactating and pregnant women were urged to be vaccinated, no pregnant or breastfeeding women were included in the vaccine trials.